Next is cholesterol absorption inhibitor. The way it works is it works by blocking absorption of cholesterol in the small intestine. If you look at this image here on the right side, so let's focus on the right side of the picture. This is the small intestine, so basically this is how it works. So it just prevents the absorption of cholesterol from the small intestine, therefore lowering the cholesterol level in the bloodstream. So the therapeutic effect, unlike the other cholesterol medication, this decreases the total cholesterol. So it's not just focusing on one kind of cholesterol, this reduces the total cholesterol level. Indications: hypercholesterolemia or high cholesterol levels. Precautions: definitely take precaution when it comes to GI disorders, especially because we know that the mechanism of action is happening in the small intestine. Contraindications: it's a pregnancy category X again, so based on some studies, it's shown that risk versus benefits, that the risks outweigh benefits for
pregnant women
because it can increase the risk of issues when it comes to the development of the fetus. And another contraindication is definitely liver disease. So knowing how it works, right, the mechanism of action, the precautions, the expected side effects from what we know is: 1, abdominal pain. It can cause nausea and diarrhea. Some nursing actions or nursing interventions: follow the lipid panel. So we want to know what our cholesterol levels are, especially the total cholesterol. And we also want to know the liver function test results. Why? Because we know that it can affect the liver. Another thing that we want to monitor is our GI status and response. So how is the patient tolerating it? Is it causing a lot of discomfort? Is it causing a lot of GI distress? Examples of drugs in this class is Zetia or ezetimibe. So some alternative treatment, or basically treatments that are often used but are not necessarily FDA approved. One is niacin or nicotinic acid. There are some studies showing that it does affect cholesterol levels, so it helps lower cholesterol levels. And also we have flaxseed and garlic. Again, these are not FDA approved, but these are alternative treatments for dyslipidemia or high cholesterol. Also in the market, there are combination drugs. Sometimes a combination of drugs is more effective rather than just one pharmacological class, because they work synergistically and it does help lower the cholesterol more effectively compared to just a single agent. So examples of those is the Caduet or atorvastatin and amlodipine. This is actually not a combination drug for cholesterol only. This is a combination of cholesterol and blood pressure medication. So we have a statin and a calcium channel blocker combination. And when it comes to the combination for cholesterol lowering agents, we have the Viterin or simvastatin with ezetimibe. So if we can go back and look at the image that I previously showed you. So this is the reason why sometimes the combination drugs are more effective, because then we have the effect of the statins, which helps reduce the production of cholesterol. And then on the other hand, we have Zetia or ezetimibe, which inhibits the absorption of cholesterol in the small intestine. So in combination together, they are more effective in lowering the total cholesterol levels in the bloodstream.